Welcome to the video on introductions to patient-centered care. Today we'll talk about patient-centered care only. So let us understand the roles, the objectives. Basically, one of the patient-centered care is all about reducing unnecessary hospitalization. Next goal is all about the encouraging patients and the families to collaborate in goal setting and decision making and self management per se, as the case might be. What are we looking at it? We are looking a number of points, as in the goals of reducing hospitalization, of encouraging families and patients to collaborate in decision making as to what is to be done and how it is to be processed as far as diagnosis and intervention is concerned. Remember, next point is of incorporating the patient and the family feedback, continuity between the patient and the care team, patient empanelment, providers availability 24 hours, 7 days a week, technology for scheduling and communication options. These are the various milestones that we would love to address as such. The models of patient provider partner relationships or partnership, if I may say so. Again, patient provider relationship. Paternalistic is the physician or the provider is viewed as an expert and authority on healthcare. As such, no one disputes the authority, the physician in this case. Informative is provider is a technical expert who simply provides information to the patient, and the patient holds the decision making power as to what intervention that he or she is going to proceed with. Remember, the patient is going to take a decision about only his or her health. So that is what informative. As a provider, you are not being paternalistic as in governing what should be done, giving advices, but in informative session, you are just giving information and letting the decision power, making power being given to the patient itself. Next is the interpretive or deliberative. Provider serves in the role of a counselor, friends, advisors, or teacher. Now, this is the patient-provider relationship of paternalistic, informative, and interpretive. Interpretive, a patient and a provider are mostly treated as friend, and they would have said as what is the best courses of journey in case they would have been in a position. So, as a counselor, as a friend, as a teacher, that they speak up, and that is the relationship that we go around it. The partnership model and how do you go for these partnership models altogether? This is what you need to understand. Health is determined by more than the healthcare patient. Clinical care makes about 20% of any person's health outcome. To address the disparities, providers must seek to address the social determinants of health as well. Patients are diverse individuals who are active agents in their own health provider. Providers play the role of facilitators who helps patients achieve their own health goals. Now, that is what we would love to address altogether. So, that is the partnership model that we would advocate. So, what's wrong with the traditional model? Traditional model, patient have always have a choice to take a medical advice. That is one of the traditional model. Patient have assets to contribute to their own care, as in what they would have done it on their own. And social condition places limits on what patient can do for their health. After a point, the families would take responsibilities thereby, and that is what the traditional role was all about it. So, is this right? Is this the question that we need to speak about it, and how do we proceed accordingly? So, a note about trust. The Tuskegee study, way back in for 42 years, it happened in from Tuskegee study, which was carried in the year 1930s to 1972, about the patient provider relationship. We have now internet, which is basically opening up the medical facilities and medical intervention technique in a most radical way and most constructive way. In fact, if I may say so, many patients have had life experiences which has left them to distrust providers. Now, why this life experiences? Well, the providers are also a mix of people, good people, bad people, ugly people, and there might be people who would be only not interested only in the provider's head, but also interested in their own commercial welfare. So as a result, this might have led to some sort of distrust, disarray in the treatment thereby. That needs to be understood. Now, that is the reason why we keep on saying as patients, as partners per se, there are always two experts in the room. The one who does not have expertise in medicine is an expert in their life experiences, in their abilities, in their willingness, in their culture, and probably in their attitude altogether. Recommendations stop at the middle of the room. It is ultimately the patient with who will live with the care decision as long as possible, and that needs to be addressed then and there. The providers, patient as people. Now, let us look into the agency's biasness. Think of people action as a primary cause of an outcome. Now, what can the people actions of delayed in approaching a provider? Let's say why? Because they think that the disease or the illness that they are carrying is not that serious enough. One, or probably the medical center is located in a faraway places from the places of residence. Two, third might be simply the economic reasons, if we may say so. So, thinking of people action as the primary cause of an outcome. Now, this might have delayed or complicated the disease or intervention process altogether, or otherwise. So, what are we looking at it? At the end of the day, both the patient and the provider are people and they have their own psychology to deal with. Let us talk about the cultural competence and ability of system to provide care to patients who are diverse and tailor delivery of the system. That is what we need to understand. At the end of the day, every individual is different from the another one. And we have to take that into consideration. Implicit bias, unconsciousness, and unintentional discrimination that creeps in no matter what you do and how it figures out. Health disparities, unfair preferences in health due to inequitable social condition, as the case might be. So, yes, as people, there are differences, as in unconsciousness bias, we are talking about health disparities, we are talking about cultural competence, we are talking about agencies, biasness, as the case might be. And that is what we are looking forward to it. So, we spoke about implicit bias, which is unconscious. Both the person and the providers, both the patient and the providers will have their own set of things which they are very much worried about it. And they might be having a sense of reputation that they would love to go around, the sense of gut feeling that they would love to go around, and that is those unintentional discrimination that comes around it. Health disparities, yes, there are certain communities, certain people who are resilient towards certain diseases, who are resilient towards certain way of life, and which they would not like to uh, discourage or which they would not like to leave at all. In fact, their adopted lifestyle is what they are very passionate about it. So these are my health disparities that comes around it. So what moves us forward? Using shared decision. This is where the patient and the provider needs to come forward and make a shared decision via conversation, which is based on respect and dignity, information sharing, participations, and collaboration, making one another understand their perspective, their way of thinking, and only then the trust issues will be dealt with. So, HCT taking steps is where any provider can take such steps, such as pausing to notice an implicit biasness altogether. And how does it comes around? We are talking about any provider can take steps as pausing to notice the implicit bias, emphasize by understanding without judging, practice humility by acknowledging what you don't know as on when on basis. So uh, these are the steps that needs to be taken around. These are things that we need to understand every now and then. Uh, Rethinking compliances. Healthcare systems may label patient as non-compliant when patient don't follow through a plan of care. It may have developed without their inputs, or possibly in the context of their lives, as in who is failing. That is what the healthcare system may label a patient as non-compliant. Now, either the patient is failing or the system or the provider is failing, so one can always blame the another fellow. This is where we need to understand as rethinking compliance, and as in who is at the fault, the patient or the provider. Dr. Martin Batterley, the healthcare system should be seen as a service that should be co-produced by patient and provider thereby. So there are three questions that everybody should be asking everyone. In the IHI, the National Patient Foundation, in way back in May 2017, stated these three questions. Ask me three educational program that encourages patients and families to ask at least three specific questions of their provider to provide better understanding of their health condition, what they need to do to stay healthy. As in, what is my problem? What do I need to do, and why is it important for me to do like this? This will clarify and give a better, clearer picture to the provider altogether. In fact, this will also give a clearer, better picture to the patient altogether, as in what kind of question, at least three questions that any party can be asking before going for an intervention. As in, the patient can ask as, what is my problem, what I need to do, and why is it important for me to do this way. So, in conclusion, patient provider model needs to be evaluated, re-evaluated again and again, and must change, must adapt. There are number of barriers for both providers as in biasness and patient as in literacy to overcome. Ultimately, patient-centered care is up to the medical centers to develop and direct. Just to wind up, we need to understand communication at the end of the day is key. Without communication, nothing can improvise. That is what we should always looking for it. With this, I come to an end. Thank you.